on animal irritant. So you can see on the PowerPoint. So there are 4 types of animal irritant poison. And today we'll only discuss on the snake bite and cantharids. So for number 2 and number 3, you can go through the journal and then you can read, okay? The number 2 and number 3 are not so important. So worldwide, can you please mute yourself? So worldwide, around 3,500 species of snake are found, and among them, 350 are venomous or poisonous snake. And in Nepal, 89 species of snake are recorded, and so far, and among 89, 17 are venomous or poisonous. Okay, and the next one is most common snake bite cases in Nepal are due to cobra and krait, and mostly occur in Tarai region during summer season. And each year in Nepal, around 20,000 snake bite cases has been recorded, and among those 20,000, 10,000 death occurs due to venomous snake bite. So classification of poisonous snake. So poisonous snake are classified into 5 types. So the first one is elapid. So this kind of snake will release neurotoxic venom, and some of the example includes cobra, krait, coral snake. And the second one is viperid. They release hemotoxic venom. And examples are Russell viper, soy skull viper, pit viper, rattlesnake. Third one is hydrophidae. They release myotoxic venom, and mostly are sea snake includes on this category. And number 4 and number 5, Colubridae and Atractosporidae, they are not found in Southeast Asia region. So we are not discussing this one, number 4 and number 5. So mostly focus on 1, 2, and 3. Elapidae, Viperid, and then Hydrophidae. So these are some of the poisonous and non-poisonous snakes that are found in our country. Okay. One is poisonous, Russell viper, and then soy skull viper. Poisonous snake, pit viper. Poisonous, poisonous. See the difference between the banded and then common krait. This one is poisonous. This is non-poisonous. 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 Okay, so how to differentiate between the poisonous and non-poisonous snake? So what are the features? So the first one is belly scale. So belly scale in case of poisonous snake are large and they cover entire breadth of belly. So whereas in the case of non-poisonous, the belly scale are small or moderately large and they do not cover the entire breadth of the belly. So this is the picture. You can see the belly scale in case of poisonous cover the entire breadth, whereas in the case of non-poisonous, you can see small or medium size and they do not cover the entire breadth of the belly. So the first one is belly scale, and the second one is fangs. So the fangs in case of poisonous snake are hollow in nature, whereas in the case of non-poisonous, they are short and solid. Teeth, 2 long fangs are present in case of poisonous, whereas in the case of non-poisonous, multiple small teeth are present. Tail compressed, whereas tail are not much compressed in case of non-poisonous snake. And habits in case of poisonous, it is nocturnal. mostly active at night. Whereas in the case of non-poisonous, it is variable. And the bite marks, two puncture marks are seen in case of poisonous, whereas in the case of non-poisonous, you will see multiple mark in row. And that is due to the presence of multiple small tooth. Next feature. The shape of the head in case of poisonous is triangle, whereas in the case of non-poisonous, it is round. And pupil, elliptical in shape, whereas in the case of non-poisonous, pupils is round. And the next one is pit. Pit is present in case of poisonous, whereas in case of non-poisonous, pit is absent. And the next one, last feature is soft caudal plate. So you can see on the soft caudal plate here. So in case of non-poisonous, it is divided into two rows. You can see divided into two rows. Whereas in the case of poisonous, there is only a single row of soft caudal plates are present. So these are the 7 and 8 features that is used to differentiate poisonous and non-poisonous snake. So poisoning by snake venom is called opitoxemia. That is the term we used. Okay. And the next one, venom of different species of snake has different toxicity, composition, and antigenic structure. That means different species of snake venom has different toxicity, their composition, and antigenic structure. And the venom is mostly composed of 90% of protein, polypeptide, and organic and inorganic substance. And this protein, polypeptide, organic, and inorganic substance are classified or categorized into enzymatic and non-enzymatic components. These are some of the enzymatic components you can see on the bold letter that are the enzymatic components. So we are not discussing in detail. So they are found in snake venom. One is fatal dose. So you can see on the picture, the above one, the solid granule parts, that is the dried venom. Okay. So the fatal dose of crate is 6 mg, whereas the fatal dose of surgical viper is 8 mg, and cobra is 15, and the Russell viper is 20 mg. So among these four, crate is the most potent one. Signs and symptoms of snake bites will depend on these following factors. So the number one is location, depth, and number of bites. Second one is length of times the snake holds onto the victim body. And the third one is amount of venom injected. Fourth one is species and size of the snake. And the next one is condition of the snake. Condition of the snake fangs. So whether the fangs is in healthy position or it is old or broken ones. Signs and symptoms will depend on that one. And the next one is age and size of the victim. And the next one is victim sensitivity to venom. So we know that venom is composed of many different kinds of components as well as antigenic structure. So some individual or person may be sensitivity to venom. And the next one is bitten area, whether covered with cloth or not. And the last one is first aid and hospital treatment. So these are the non-factors. Signs and symptoms of snake bite will depends on. Next one. So the symptoms we see in case of elapids, snake bite. So the local symptoms is seen within 8 minutes of snake bite, and the symptoms include small will develop in the bitten area, and the person will complain of inflammation, burning pain, tenderness, and there is presence of oozing of blood on the bitten area. Okay, and the swelling will be absence or minimal. So these are the local symptoms seen on the bitten area. One is systemic symptoms. So systemic symptoms will appear after 30 minutes, after half an hour. And the symptoms include nausea, vomiting, excessive salivation, headache, vertigo, paresthesia around mouth, and drowsiness. And there is also presence of ptosis and external ophthalmoplegia, and this is due to the paralysis of eye muscles. And later on, there will be paralysis of lower limbs. So paralysis of lower limbs means, so the patient will complain of weakness, unable to walk by the legs, and that is followed by paralysis of face, palate, jaw, tongue, and vocal cord. That means the patient will be unable to speak and difficult in swallowing of food. And the next one is there will be paralysis of neck muscle, intercostal muscle, and diaphragm. That means there will be paralysis of respiratory system. Next one, in case of viperits, snake bite cases. So local symptoms same, appears within 8 minutes. And the symptom includes pain, tenderness, and persistent bleeding. See the difference between the elapid and the viperid. So in case of viperid, there is presence of persistent bleeding. And swelling can be seen on the entire bitten limbs or as well as on the adjacent or another limbs. And there is formation of blister as well as necrosis of the tissue. Symptoms same, appears after half an hour, and the symptoms includes bleeding from the floor of mouth, bleeding from the gastrointestinal tract, genitourinary tract. There is the bleeding from the tympanic membrane, petechial hemorrhage and ecchymosis can be seen over the entire body. Epistaxis, hematuria, hemoptysis, headache, blurring of vision, dizziness, decrease in blood pressure, tachycardia can be seen, and at the end, patient dies of hemorrhagic shock. So in case of elapid, you will see the paralysis symptoms, whereas in the case of viperis, you will see the bleeding symptoms. Okay, that is the difference between this one. You see the two fangs mark, you can see the blister formation, okay, some of the feature, and this is the bleeding from the floor of the mouth. Management of snake bite. Management or treatment includes, first one is first aid, or this is also called pre-hospital treatment, and the second one is hospital treatment, and it includes symptomatic as well as anti-snake venom treatment. First aid management or treatment. First step you have to do is reassure or calm the patient or the victim. So victim or the person may be in a state of fear or shock after snake bite. So first thing is you have to calm the patient. And the second one is pressure immobilization technique should be done on the bitten limb, or this is also called pseudo-relent wrap. And this type of immobilization should be done using crepe bandage. So you can see on the picture, so you can use the crepe bandage, and it should be wrapped starting from the distal end towards the proximal end, and it should be wrapped around the whole entire limbs, bitten limbs. And while wrapping the bandage, it should be make 1 or 2 finger loose. And the reason is, so it should not occlude the circulation of the arterial blood supply. Okay. So wrapping, starting from the distal ends towards the proximal end to the whole entire bitten limbs. And while wrapping, it should be make 1 or 2 finger loose to prevent the occlusion of the arterial supply, blood supply. Once the bandage is done, the bitten limb should be immobilized, and the patient or the victim should be transferred to the nearest hospital for further management and treatment. So only remove the bandage once the person of the victim has received anti-snake venom treatment and or symptomatic treatment. And the indication of this one, pressure immobilization, it should be done only in case of elapid or snake bite cases. And the reason is it will slow down the absorption of venom, whereas in the case of biparates, it is contraindicated. So pressure immobilization should not be done in case of biparates. Next one. So things you have to avoid in case of snake bite. So the first one is do not use ice pack or chemical on the bitten area. Do not make local incision on of the wound. Third one is do not try to suck up the venom. Okay, do not use electric cautery, and also do not use or apply tourniquet, and do not let the victim drink alcohol. So alcohol will increase the absorption of the venom, so it should be avoided in case of snake bite case. Hospital treatment. So the first one is airway, breathing and circulation. Clear and maintain. Okay, airway, breathing and circulation. And the second one is if the victim has no symptoms, there is only presence of mild symptoms or mild local swelling. There is no presence of any systemic symptoms. So remember the systemic symptoms. No presence of any systemic symptoms. Lab test normal, then you should keep the person under observation for 24 hours. No need of anti-snake venom in this case, okay? And you have to monitor his or her vital sign as well as urine output. And then you can give injection TT and discharge the patient. Now advise the patient to come back to the hospital if he or she develops any of these following symptoms. So the warning sign or the symptoms includes increase in pain or onset of redness or swelling, fever, epistaxis, bloody or dark urine or also dark stool, nausea or vomiting, fatness, shortness of breath, diaphoresis or any other symptoms, then advise the patient to come back to the hospital immediately. So these are the lab tests you need to do immediately as well as after 12 hours. So you can see on the asterisk, it should be done immediately and repeat after 12 hours. And rest of the test, it should be done depending on the person medical history as well as the case. So this one is the lab test. Now anti-snake venom. So there are two types of anti-snake venom. One is the monovalent and the next one is polyvalent. So monovalent is made from venom of only one species of snake. So if you have identified the species of the snake, then you can give monovalent. Or else you have to give polyvalent. And the polyvalent is made from venom of 4 poisonous snakes. And those 4 poisonous snakes are cobra, common krait, Russell viper, and then saw scalp viper. And since this polyvalent is made from the 4 poisonous snakes, the sensitivity or the anaphylactic reaction of this polyvalent is much more higher than the monovalent. So there should be always presence of antihistamine, hydrocortisone, and then adrenaline in your emergency kit. Okay. And the next one is indication of anti-snake venom. So when to give anti-snake venom? So in case of alapid snake bite, so if there is presence of ptosis or peripheral neuropathy or systemic symptoms, remember, then you can start anti-snake venom treatment. And the dose is 10 vials. It should be mixed in 500 ml of distilled water or normal saline and should be given within first 1 hour. And then you can repeat the second dose after 1 hour. So along with this anti-snake venom, you should also give neostigmine 1.5 mg intramuscular with atropine 0.6 mg IV. And then you can repeat the dose after 10 minutes, okay? And if improvement is seen in the condition of the patient, then you should taper the dose of the neostigmine to 0.5 mg. And the role or the function of this neostigmine in case of elapidated snake bite is it will reverse the muscle paralysis symptoms. Next one, in case of bipolar snake bite, so any evidence of systemic signs and symptoms, lab test abnormal, or there is significant progression of local symptoms. That means the swelling has covered the entire bitten limbs, or it has also present on the across or adjacent joints, or the swelling has covered the half of the bitten area, then you should start anti-snake venom treatment. Dose is same, okay, but should be given within first 6 hours. That is the difference. And the second dose you can repeat after 6 hours. And depending on the lab test, you can do blood transfusion or plasma transfusion, as well as you can give heparin. So looking at the lab test. Symptomatic treatment, pain analgesic should be given, but aspirin should be avoided because aspirin will cause bleeding, so it should be avoided. And the next one is sedation should be given. Injection TT should be given, as we have already discussed this one. And the next one is surgical debridement should be done. If there is presence of necrotic or dead tissue, then it should be done, surgical debridement. And the next one is in severe tissue involvement, antibiotics should be started, and avoid alcohol and morphine because they will increase the absorption of venom. Postmortem finding external, so 2 puncture mark can be seen or sometimes 1, and there is presence of bleeding, okay? And the next one is internal finding. We do not see any specific finding in the internal organs. So the medical legal importance, most common is accidental in our country. So most common is accidental, mostly seen in Tara region, so among the farmers and during summer seasons. And the suicidal and homicidal are very rare. So precaution that you have to take from snake bite. So these are the 5 precautions. First one is flash or torch or light while walking outside at night. So if you have to walk outside at night, then you have to flash the torch. And the second one is never handle or recently killed snake because the reflex are still present, so it might bite you, so never handle, okay? And the third one is avoid places where snake may live. So places such as tall grasses or bushes, fallen logs, swamps, deep hole, etc. Such places should be avoided. If you have to go to such places, then poke the ground in front of you using the long stick, or you can wear long leather or rubber boots up to your knee length. Wasps and hornet, we are not discussing this one, not necessary. Scorpio sting, not necessary. And the last one is cantharids, or this one is also called Spanish fly or blister beetle. The active principle is cantharidin. Cantharidin is the active principle of cantharids. And the fatal dose is 10 mg of active principle or 1.5 gram of powder beetle. So powder beetle means the beetle is killed and it is dry and make it into the powder form. External application of the powder will cause redness and burning pain on the skin area, and there is blister formation It's seen after 2 to 3 hours of redness and burning pain. And the internal administration, oral intake, will produce symptoms such as nausea, vomiting, blister formation in the oral cavity, burning sensation in the stomach, throat, and there will be inflammation of gastrointestinal tract, genitourinary tract, patient complaints of the dull pain on the loins area, and desire to micturate, but the person is unable to urinate. Okay, and the priapism is seen in case of male, whereas the abortion is seen in case of pregnant female. So priapism means it is a painful and prolonged erection of the penis, and mostly seen in case of male. Medical legal importance, mostly used as aphrodisiac agents. So aphrodisiac agent means any chemical that is used to increase libido or sexual desire. So that is the reason why it will result in accidental poisoning. And the second one is it can be used as abortifacient agent, means any chemical that is used to induce abortion. So these are the two medical legal importance. This is the assignment for you. 2 questions.